Hello, good evening, everyone.
Hello, good evening, everybody. Good afternoon, also simultaneously. This is
Depends on
Dr.
where you
Shiraz Farooq and Sydney Farooq.
Hi.
Hi, guys. We're here at Colorado, America for the DaBootyDoc Talk.
If you haven't joined us before, this is our educational series that we have to entertain you and enlighten you a little bit too about colorectal problems of the rear and such.
Yes, guys, the DaBootyDoc Talk is here with the DaBootyDoc, board certified colorectal surgeon Dr. Shiraz Farooq and my spouse Sydney Farooq.
Board certified wife.
I like that. Yes, we are here to talk about colorectal problems that we see in the community, and we thought that it's a good idea to give out some information and some education to our friends and family and the public, and make them laugh a little bit. Sometimes, humor is good stuff. Laughter is the best medicine.
That's right. So we're gonna talk about today an interesting topic. This is our 16th episode, and we probably mention this every episode, wouldn't you say?
I think almost every doctor talks about this topic to some extent, or they should, because this is one of the fundamental things that everybody should know and should be experiencing.
But what's unique about our conversation is we're discussing it in light of colon health. So the
Correct,
topic
guys.
today is, Doctor?
The topic today is very easy. It is what does exercise do to your colon health, or how is exercise going to improve your digestive health? Something like on that terms.
Yes. So exercise.
Exercise is
It's
good for you.
important, and we want to know why it specifically relates and affects your colon health. So let's start off our discussion. I think there's a couple of different reasons here. So starting off, it improves
Your ability to go. Colorectal health
bowel
is
movements.
dependent on making the bowel movements go through you. So the food that we take processes from the mouth, gets chewed around, goes through the pipelines that are there, including the esophagus, the stomach, gets digested in the small intestine, and then is excreted out of the anus or the rectum through the colon. And the colon's job is to filtrate all the bad stuff and poop it all out. So if you work out, if you exercise, you have a chance to have a very good bowel movement or improved motility, and your function of the colon improves because the colonic lining is muscular. So the muscles in the colon actually move better, work better when you're able to have a good bowel movement. And good bowel movement equals good colonic health.
So even if you're elderly or you're not lifting weights, or is minimal exercise equivalent, or do you need to be doing, really hard training, or what do you mean by exercise in terms of?
You don't have to be an Olympic athlete. What they have found out is that even 10 to 20 minutes of daily exercise is healthy for you. So any exercise is better than no exercise.
Right.
So if you're walking, if you're running, if you're jogging, if you're swimming, if you're biking or bicycling, or lifting weights or something, they're all very good exercises. And these exercises are all very healthy for your colon.
Which is something you probably don't think about, but makes sense, right?
And what happens is that when you've just worked out, it causes stimulation of your colonic musculature, and the muscles in the lining of the colon are able to contract more. And that contractility causes you to have a better bowel movement. So good exercise means good poops.
So if I work out, or I guess if I'm having trouble with bowel movements, do I exercise? Is that going to be like something that might help me pass?
Yes, I think that's a very good idea, and that can make a difference. Also, exercise improves the blood flow inside the colon. So as you're stimulating the muscles, your blood vascularity in the lining of the colon is improving also. And that causes increased oxygen delivery to the cells, as well as improved digestion of the colon and the small intestine. So exercise causes the blood flow to increase, the blood vessels get dilated, and that causes oxygen to go inside the cells and nutritional and improved nutrition. So that's why exercise can make a difference in colonic health.
So not only does it help your bowel movements, but helps with your circulation
And
as
your
well.
digestion. Also, we have found out that colon health is related to exercise in the sense that people who exercise have a lower chance of colorectal cancer.
So it can reduce your risk as well.
Yes, I see on your top that you're wearing, it says prevent colon cancer.
That's right.
So exercise along with diet are two things that every doctor should talk to their patient.
Mm-hmm.
So what do? Talk about diet and talk about exercise. So we have talked about diet a lot, and I thought we should start talking a little bit about the other component of our health, which is exercise.
Yeah.
So they did a study, well, they've done lots of studies. I mean, studies are done all the time, okay? So this study was done on some healthy volunteers who were made to exercise. And after doing a regular exercise, they took some blood out of them, and they were able to run some tests. And they found out that a special protein called interleukin 6 is or IL-6 is elevated in people immediately after exercise. And this IL-6 cell or protein is protective for colorectal cancer. And when they injected this blood into the cells of cancer cells, they were able to see an improvement, and they were able to see that the cancer cells started to die. Also, they noticed that our body, when we do high intensity exercises or quick workouts or rapid bursts, that causes our immune systems to release cells called natural killer cells. These NK cells, or natural killer cells, are the ones that fight against cancer. So in people who exercise a lot, their immune system is revved up. And natural killer cells are one of the first agents that come out there and help to kill the bad cells. So exercise can make a difference. So far we've talked about constipation, improved digestion.
No, we talked about circulation.
And improved digestion and colorectal cancer prevention.
And improved bowel movements, I guess is what you mean by digestion.
Correct. Do you know that exercise can also improve weight management?
I hope so.
I
Doesn't
hope
just
so.
make you muscular, but it helps you lose weight too?
Yes, that's a very simple thing. And exercise causes us to burn calories. So calories, when you are exercising, the caloric intake will go up, and what will happen is that you will burn those calories faster. So you eat more, but that act of digestion causes you to digest the food faster, and that causes you to lose some weight. Secondly, when you're exercising, you have frequent bowel movements because you have less constipation, because bowel movement is going through. So as it goes through, it takes care of all the toxins that are inside the colon lining. So rapid transit, meaning quick action of the food as it passes through, will allow the cancer toxins to be less inside our body. So it will allow you to have less problems, and constipation is improved, oxygenation is improved, as well as rapid transit, and that causes less contact with harmful agents in the body.
Mm-hmm.
And that is something that can help us also.
So what problems would you have, colorectal problems, if you were overweight?
So overweight patients can have a lot of problems, guys. Number one, they can have constipation. They can also get IBS-like symptoms, and sometimes that can get better. Overweight patients also have increased cholesterol. So when you're exercising, your bowel movements are going through, so they're removing some of that cholesterol that your body is making, and that will also cause you to lose some weight. Another thing I forgot to mention is that it can cause your gut bacteria to be better. So good gut bacteria is a very big deal. Yes, guys? We all have heard about probiotics and microbiome and colobiome. So the Uh, Bacteria inside the colonic lining are better when you exercise because they get better oxygenation. The bowel movements are going through, so you don't have fermentation for a long time, and the food doesn't stay in the body for a long time. So the bacteria health improves, and you have better quality of bacteria. So here, diversity improves, and your colonic bacterial cell count improves, and that helps to improve your colonic health.
Very interesting. So we addressed a couple of things on how exercise is good for your health. Give me maybe some more specifics here. So they're helping prevent specific problems. You kind of mentioned a couple of them.
Yeah, so I mentioned constipation. I mentioned briefly irritable bowel syndrome, IBS, which also has diarrhea and constipation. So improve bowel function will definitely make a difference there. Thirdly, we have a lot of people in America who have heard of diverticulosis. Again, diverticulosis is a colonic problem where there are pockets in the colon and food gets stuck in those pockets, and that causes us to get sick. So if you have good bowel movements, meaning you eat better and you exercise and drink lots of water, you're going to move that food through the colonic lining. So diverticulosis patients have better outcomes when they exercise. Fourthly, we already know about colorectal cancer. We know that patients and people who eat better and exercise better, their risk of colonic polyps goes down at least by 30 to 40%. Yes, guys, colonic polyp formation drops when you exercise long term. Secondly, we also found out that the patients who or the public who exercises can reduce their risk of colorectal cancer to about 20%. So a 20% lifetime reduction in colorectal cancer with exercise is a very big deal, guys.
Now, putting these things together, it's kind of like one solution for a whole gamut of problems here. So there's certainly other things too that exercise can help with that might contribute to your colorectal health as well.
Correct. Increased metabolism, increased digestion, as I mentioned, better gut bacteria, all of that boosts immunity. And what it does is that it causes you to have better cells in the body, less inflammation, and less chances of disease. So disease gets better when you're less inflamed. And inflammation is improved with improved oxygenation and improved digestion and delivery of nutrition to your cells. And that is relevant because colon is part of that system that improves all of that. You get it, guys?
Pretty impressive. So exercise is the magic along with what you eat, of course. Now,
eat more, walk more. No, eat less, walk more.
Eat more of the right things.
Yes, but eat less quantity and exercise more. Those are two things that I found to be very important for all of us.
True. All right, now I know you might have some exercises up your sleeve, so I want to know, what is going to be best?
So exercise comes in all forms, guys. They can be aerobic exercises like running, walking, jogging, swimming. You can do high intensity workouts in a CrossFit or in a gym where you go and you lift weights. You can also do like core bodies exercises that will help the abdominal muscles. You can also do yoga and other exercises that like sort of like strengthen the muscles, as well as pelvic floor exercises. Here
Talk a little bit more about that.
Yes, see, pelvic floor exercises nobody does, and we see a lot of people with pelvic floor problems, hemorrhoidal issues, incontinence, constipation. All of these issues are because our pelvic floor is not working as well. So
is it a muscular problem? Is it a circulation problem?
Both of them, circulation as well as muscular problems. The pelvic floor muscles are responsible for continence of urine and stool. So if you
Continence meaning your ability to hold it.
hold it. So if you are exercising your pelvic floor muscles, you're going to have better control of your bladder and better control of your bowel.
And if you're having incontinence issues, usually you tell patients to exercise their pelvic floor, right?
Correct. Pelvic floor is very important, guys. So doing squats, doing leg raises, those kind of exercises can make a difference. And there are other pelvic floor exercises like Kegel exercises, which anybody can do anytime, which basically is an exercise where you try to work your bladder muscles. And the way to do that simply is when you go to pee, when me and you or anybody goes out to pee, you have to you can stop your pee and you can let it go. So the muscles that you use at that time are the pelvic floor muscles. So if you voluntarily squeeze your urethral muscles, and you do that when you want to stop peeing in the middle of a stream, those are the muscles that you voluntarily squeeze, and that exercise is called Kegel exercise. And that exercise is very good for the pelvic floor.
You may have heard of that before, especially the ladies out there during childbirth and such, but Kegel, Kegel, Kegel exercises. So, and you can do that anywhere. You can be sitting at your desk at work and give a little squeeze here and there, right?
And those squeezes over time really improve your pelvic floor. I tell people that, think of that as a weightlifting or a dumbbell for the arms. If you're lifting 5 to 10 pound weights, your biceps and triceps will get bigger and bulkier, and your muscles will improve. Similarly, pelvic floor exercises can improve the ability to hold your bowels and your bladder better. So those are very important for colonic health.
Interesting. What's some good examples of like high interval intensity training? Is that for athletes or?
I think anybody can do that. Basically, these are short bursts of rapid exercises followed by long bursts of slow resting exercises. So you can think of that like a 100-meter race of somebody who runs 10 meters and then the next 90 meters they do a slow jog. And you can do that with running, with biking, with swimming, with anything. So it's high intensity, very quick exercise followed by slow motion, $6 million man movements. Okay.
So maybe if you're doing things like aerobic exercises or yoga and stretching, you can combine it with some high intensity intervals too.
Correct. And I think that's very important because exercise can be done anywhere by anybody, anytime. So if we take out 5 to 10 minutes, up to 20 minutes a day, and we say to ourselves, look guys, this is a body that God has given us, let's move it. Move it up, move it down, move it sideways. You want to improve your overall health.
You're right.
So that is important,
No matter what age you are, a little bit of movement can't do you any wrong, because we definitely know that being idle and non-mobile.
Especially for people in nursing homes and elderly population, if they just move around a little bit, move their arms, move their legs up and down, they will see that their chances of constipation and fecal impaction and all that goes with that, including bloating, gas, heartburn, feeling sick, all of that can improve. So move it. You got to move it. Okay? Very important.
I also personally recommend exercise the 5 Tibetan rites. Something I do at home, doesn't require any equipment, takes me about 15 minutes. So I encourage you to look that up. If you're looking for like an easy solution, you can work out at home with the 5 Tibetan rites. So
that's a very good exercise along with walking, running, jogging, swimming, biking.
Get a bike.
Anything like that. So if you don't have any of these things, stand up and give me 10
Jumping
squats
jacks.
and 10 jumping jacks and 10 sit-ups or something like that.
Yeah.
So all of those exercises will improve your core body, and that will make a difference, and that will improve your colonic health.
What about exercises that are bad for you? Because some people are extremists. I know you guys out there, he tells you to go to the gym, you're going to go start weightlifting, deadlifting every day.
So all exercise is good for you if done in moderation. Okay, when you do exercise that is done more than you need, if you're starting to do heavy lifting and deadlifting and you're doing it without form, if you're doing it too much, and if you're not hydrating yourself, and if you have poor form, those things will make a big difference.
Or if you have injuries, keep that in
Yes.
mind too. You know, you don't want to be suffering from some herniated discs and start
Correct.
becoming a
Or
weightlifter.
you could ruin your arms, your elbows, your knees if you don't have proper form. So if you're in a gym and if you don't have the right trainers and if you're doing heavy lifting, if you're not drinking a lot of liquid and hydrating yourself, that's a very big deal. So hydration plays a very important role. As we have mentioned, we're all cucumbers. Okay, we're all full of water.
And you say
So-
we're like 90% water.
More than that. And so we need to drink lots of fluids. So hydration is something that is very important because that will allow the food and the bowel movements to slither through your colon and slither out.
Now, do you have anything else to say about that? Because I did see a couple of patients or I don't know, viewers rather ask a couple questions during our session here. So do we have a
Yeah.
couple minutes at the end to go over things maybe slightly off topic?
Yes, one of the topics that was brought up is whether Metamucil is good for you. Metamucil is psyllium husk, which is soluble in insoluble
What's
fiber,
it for?
and it's very good for your body.
Metamucil's for
Increasing fiber in your
so
diet.
it's a fiber
Fiber
supplement.
supplement.
Okay.
Another
Not a
thing-
stool softener.
Not a stool softener. Another thing that can help is if you're doing intermittent fasting. So somebody asked about that. Basically, your bowels need a rest. So what that means is that you cannot be eating 24 hours a day. Okay, we're not cows, okay? And even cows have to go to sleep. So cows
They
have,
have multiple stomachs. too.
yeah, so they have more than one stomach, so
They
they
can pull it
digest it and they can pull it off. We can't.
Mm.
So we cannot be eating all the time or drinking all the time. So our bodies, our intestines, our colon need some rest. So that rest allows rejuvenation of the cells inside, allows the bacteria inside to regrow, allows the cells that were damaged to form again. Does the audience know that we are pooping around 80-90% of our food and bacteria that we have inside is pooped out when you have a bowel movement, and that
Do you mean like the
the composition
quality of what you
of the poop is food and dead bacteria, and the lining of the colon and the small intestine changes every 3 to 4 days. So if you have good gut bacteria, meaning good microbiome, and the cells are healthy, by adding more water, eating fiber, exercising, you're going to have a good digestive health, and your
Now-
colon will be happy.
pertain to the question about intermittent fasting? If I'm fasting, can I keep my exercise routine?
You can if you're very careful and you don't dehydrate yourself, you don't do too much where you don't have enough calories and you become malnourished. So all of those things have to be looked at. So interval exercises are good for you if done in moderation, so is any other exercise. So please try that, guys. Workouts are healthy for you. They're also healthy because when you are moving your colonic, when you're exercising, your stomach muscles that are in the middle, okay? These muscles act like a massager, and they massage your intestines. And as they massage your intestines, they are making your food pass through from the small intestine into the large intestine and hopefully out of us. So that is something also. So we can also do a little massage ourselves, you know.
That's what I was gonna mention earlier. You can do a little if you can't exercise, you can do a little belly massage. That might help your bowels a little bit.
Yes. And exercise can even be done if you're laying down and you just move your arms and your legs. Okay, if you're standing, you can sit down, sit up. You can, if you're laying down, you can, you know. So there's many forms of exercise.
So going back to our 2 questions, you saying you do recommend Metamucil as a fiber supplement?
I think Metamucil
It's
is a
good for
great
you.
fiber supplement.
Any
I
negatives about it?
Not really, but there are better fiber supplements, including ground flaxseed, which I always mention on every talk show because I feel that that is
And that's a natural.
natural superfood that can really make a difference for a lot of people.
Can you take too much Metamucil?
You can take too much fiber of any kind, and that will cause you to have bloating, excessive diarrhea, and you'll get sick. So
In moderation.
everything in moderation.
And you can consult your doctor about that too.
Absolutely, you
So-
have to talk to your doctor or your provider or your nurse practitioner or
Because
your
we're all
surgeon.
different.
We all have to do that. And
What
It's
about intermittent fasting? Does that have negatives to it, or what do you recommend? I mean, like from what I know, like fasting isn't recommended for maybe elderly people or pregnant people, or
yes, certain people may need to consult their doctor or their physician or their provider for further input about it. But overall, not eating too much is actually good for you.
take a little break.
Yes.
Let your body.
Especially at night, if you sleep and if you're eating just before you go to sleep, you're doing your body a harmful thing. So probably the best thing is to stop eating an hour or two before you sleep, because that gives your body a rest. And when you lay down and sleep, your machines inside are going to churn and burn, and they're going to cause a healthy digestion, and the nutrition is extracted properly, and you have good poops.
Very interesting. So yeah, that's a little extra information for you here, but it ties in because as you're considering your exercise routine, you're gonna be considering your dietary routine as well. So,
Correct. And
which is critical to exercising too, because you want to make sure you're getting the right nutrients, carbohydrates, and everything else.
And talking about preventing colorectal cancer. Okay, guys, this is my favorite topic, and I will talk about it again and again and again. Two things: diet and exercise. These two things will prevent colorectal cancer and improve your chance of not having this problem. So, add more fiber. Okay, drink lots of fluids, and do some exercise of some kind every day. Your chance of getting colorectal cancer will definitely go down. This is a big deal. We are finding new molecules, and new research is being done in this area, which is very exciting because we're finally understanding that it's not only medicine, but the surrounding part that the patient has to do that makes a difference.
All right, so what about these patients or anyone out there that have a clean bill? They're like, I exercise, I have a farm, I grow my own food, blah, 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 no family history, and then they get stage 4 colorectal cancer.
That can happen also, and that's just bad luck. It could be bad genetics, or it could be just environmental factors, or just bad luck. And that is why it is so important for us to get checked and get a colonoscopy.
So don't think that you're safe just because you try preventative measures. They're preventative, it's not your.
And very important, guys, another preventative tool is colonoscopy or diagnostic testing to look for colorectal cancer early on.
Yeah, so if you want to know if you have good colorectal health and you've been exercising the last 5 years, but you're due for a colonoscopy, don't say, I don't need one, I take care of myself, because you might be that person that
Correct.
is
Correct.
not so lucky.
That's a very good point. I'm very happy that you brought it up, because preventing colorectal cancer is a passion for all of us here. And the DaBootyDoc Talk is there to provide some information, some thought, and hopefully some humor to all our audience.
Yeah. So if anyone else has other follow-up questions, if we can squeeze them in the show, we will, but we're always happy to follow up afterwards too. So don't be shy if you thought of something, or you had a comment, or you want to share something, or suggest a topic for next week. Let us know. We're going to post on our social media to let you guys know too how to tune in.
So we're very excited, guys. I really wanted to talk a little bit about exercise, because I tell that to every
Are we
patient.
going to exercise something?
Absolutely. I think we should do 5 to 10 minutes of something, and I agree with you. The Tibetan 5 rites are a fantastic
Nice and
way
easy.
to do an easy workout.
I
for
got
your
my
whole body.
yoga mats back here. So
So, guys and girls, thank you very much for listening.
yeah.
The DaBootyDoc Talk with Dr. Shiraz Farooq and Sydney Farooq. We will be back hopefully next week with another topic. See you guys soon.
hopefully, no, we will be back. Thanks for your time. You guys have a great one. Enjoy, exercise, and then have some dinner.
Thank you guys. Fantastic evening. Bye bye.
Bye.